Hip arthroscopy, instructions for physical therapy. It is important that you follow the restrictions and structured rehabilitation program after your surgery. There is a significant recovery period after this surgical procedure. You need to avoid rushing through or being too active early after surgery, as this can lead to complications and delays in your recovery. Immediately after surgery, the goals of the rehab program are to decrease swelling and pain while protecting the involved structures. You are encouraged to ice frequently and rest as much as possible in the first couple weeks after surgery. Avoiding prolonged sitting in an upright posture will prevent worsening of pain and irritation at the front of your hip. Strict bed rest is not recommended, but patients should not attempt to complete usual daily activities around their home. You can move around your house, but your activity level should be limited as much as possible. After surgery, you will be permitted to have weight through your operative leg. However, crutches should be used in order to take enough weight off so that walking does not increase your pain. Even if pain is well controlled, it is recommended that you continue to use crutches for at least 4 weeks. Caution should be taken not to rush off your crutches, as this will only increase inflammation and in turn slow down your progress. During your preoperative physical therapy visit, you will be shown how to walk and go up and down stairs while using your crutches. Even if using correct technique, you should avoid going up and down stairs as much as possible for the first couple weeks after surgery. You will also be fit and provided with a brace that is to be worn while you are walking, but can be removed when you are sitting or lying down. Your physical therapist or surgeon will have you wean off your crutches once you are 4 weeks out from surgery and you are able to walk without limping. During your preoperative physical therapy visit, you will be provided with a basic home exercise program, which should begin the day after you return home. The program includes low-level muscle activation and circulation exercises, which should be completed several times per day until your first postoperative follow-up visit. It is important to have someone who can assist you with a range of motion exercise, which is included in this early set of exercises. This range of motion exercise will be demonstrated during your preoperative visit and is important to prevent any excessive stiffness and/or scar tissue formation after surgery. At your first follow-up visit after surgery, you will be provided with an updated home exercise program and a prescription to start formal physical therapy. You should bring the prescription and your postoperative rehab protocol with you to your first physical therapy visit. Your physical therapist will use the protocol to guide you through your recovery. It is important that you follow a structured rehab program following the surgery to prevent any complications or delays in your recovery. As your strength and range of motion progresses and you move toward later stages of your rehab program, your therapist will assess your readiness to begin activities such as jogging and running. In order to begin a return to running program, you must be at least 3 months out from surgery and meet specific criteria which are listed in your protocol. It is important to note that many arthroscopic hip procedures are considered preservation procedures. This means that the primary goal of the surgery was to protect your hip joint from further damage. Depending on findings during your surgical procedure, it may be recommended that you limit the volume of high-impact activities even after you are fully recovered. Your physical therapist will provide guidance for safe progression of impact activities during the later stages of your rehab program. The time frame for returning to sports or heavy manual labor varies greatly from patient to patient and is dependent on a wide variety of factors. Your physical therapist or surgeon will determine your readiness to return to these activities. This is based on the clinical exam of your hip, findings during the surgical procedure, as well as your performance on a battery of clinical tests. These tests are used to identify any remaining weakness or compensatory movement patterns during higher level activities.